Thank you for being with us, Cindy.
It's good to be here.
Sweet. So let's get right into it. So first off, let's just start with the basic question is what are house calls?
House call providers are providers who will come to the patient's home. Whether they're on home health or not, the patient can choose to have a provider come to their home versus going into the clinic. I do get referrals from home health patients who it's just very difficult to get into the doctor's office. And so they get referred to me and I will come take care of them in their home. And how that looks is basically, like I said, the clinic comes to the patient. So I will do vital signs, listen to heart, lungs, take care of their medications, wherever they want those sent. If labs need to be done, the lab people come to the patient, and also radiology can also come to the patient's home or the facility. We have both patients who are house call patients who are in facilities and who are in home.
What are some of the challenges healthcare providers face when conducting house calls?
Well, some of the challenges are that when you go into a doctor's office, everything's right there. You have an otoscope, ophthalmoscope, you have certain kinds of testing that can be done. When you're a house call provider, you have to take all of that stuff with you, and so it can be a little cumbersome, but most house call providers are used to that, and they just keep that in their trunk when they need it. Otherwise, I mean, the visits are fairly easy and simple and not that difficult other than just driving to each patient. When they're in the facility makes it kind of nice because then you can see several patients in the facility and then you might have a few at home. But either way, I mean, the drive might be a little more cumbersome for the provider and taking the equipment, but it's a very, very good service for these older patients who really have a difficult time leaving their home. So it's a really great service that should have never left medicine to begin with. So now that we have the coding for it, it makes it a lot easier for house call doctors to go and make those visits and charge insurance. Is basically like a doctor visit would be.
Perfect. How do patients and their families typically respond to the option of house calls?
Oh, most love it or on board. Most haven't heard of it. It is starting to get out there where people are more aware that that is an option for them, but a lot of people still are not aware. Applegate does a really good job making sure that their patients have a provider and connecting them with whether it's me or another provider who can go out and see that patient in their home. It actually takes a load off of the family's shoulders because they're having to get the patient, especially if they're disabled. It's very difficult to have to get them into the car, get them into the doctor's office. There might be stairs, might be elevator. And if they're really ill, it's very, very difficult for some of these older patients to get to the doctor's office. So it does take a big burden off of not just the patient, but the family as well.
From a healthcare provider's perspective, how do house calls change the dynamic of patient care?
First of all, healthcare is more accessible to patients who probably before weren't getting the best healthcare because it was difficult for them to get to the doctor's office. So it's changed in a positive way where patients are getting the care that they need and deserve. And so they're not really falling through the cracks like they used to.
Perfect. Thank you so much, Cindy.
Thank you.